Heart disease is the #1 cause of death in the U.S. Over 600,000 people each year die from heart disease. Over 28 million people are diagnosed with it. It has been one of the leading causes of death since 1975 and is the leading cause of death for both men and women. Coronary heart disease kills over 370,000 people annually. Every year, about 375,000 Americans have a heart attack. Heart disease is responsible for 1 in every 4 deaths. Welcome to our first episode of H2 versus the top 10 causes of death in the US. In this video, we'll look at what the research has to say about how hydrogen gas can potentially benefit heart disease. This includes a look at the benefits hydrogen can potentially induce for related issues like cardiac arrest, arteriosclerosis, blood pressure, cholesterol, blood sugar, and overall heart health. Then we'll top it off with the role hydrogen may play in preventing heart disease and related disorders. But first things first, what is heart disease? Heart disease is also known as cardiovascular disease and encompasses many types of heart disease. Coronary heart disease is the most common type. It is a disease in which plaque builds up inside the coronary arteries that supply oxygen-rich blood to your heart muscles. When plaque builds up in the arteries, it's called arteriosclerosis, and this buildup occurs over many years. Research suggests that coronary heart disease starts when certain factors damage the inner layer of the coronary arteries. Some of these factors include smoking, high levels of certain fats and cholesterol in the blood, high blood pressure, high levels of sugar in the blood vessel inflammation, or oxidative stress. Some major risk factors for heart disease are unhealthy blood cholesterol levels or high triglycerides, insulin resistance, overweight or obesity, lack of physical activity, unhealthy diet, or high levels of C-reactive protein. Some treatments often suggested in the medical field are lifestyle changes, such as quitting smoking, eating healthier foods, and lower fat intake, exercising regularly, losing excess weight, or reducing stress, or medications such as cholesterol-modifying medication, beta blockers, nitroglycerin, etc. Some related disorders under the umbrella of heart disease are congestive heart failure, peripheral artery disease, cardiac arrest, or arrhythmia. Now that we know what it is and how it happens, let's look at 10 ways H2 can benefit heart disease based on the current research. Number 1, hydrogen can potentially improve overall heart function. In this study, we see that the H2 present in the treatment was able to reduce severe arrhythmias and significantly restore heart function. The results here indicate improved cardiac function from implementing H2. This study found that hydrogen water treatment improved cardiac function as well as decreased oxidative stress and suppressed inflammation in the heart. It goes on to conclude that the treatment with molecular hydrogen diminished cardiac dysfunction. To top it off, this interesting study was done on chemotherapy-induced heart failure. The results indicated significantly improved heart function and decreased oxidative stress markers when treated with hydrogen. Number 2, hydrogen may improve the function of left and right ventricles of the heart. This study shows results of improvement of systolic pressure in the right ventricle with administration of molecular hydrogen. Here's another study where H2 improved the function of the damaged left ventricle as well as exerting protective effects. And here we see that H2 treatment resulted in reverse right ventricle hypertrophy among other benefits. Number 3, H2 may protect the heart during ischemia and reperfusion. Ischemia means that there is an insufficient blood supply to an organ or a part of the body. Reperfusion is the act of restoring blood flow to an organ or tissue, and while highly needed, it can cause some damage. To quote this study, myocardial, meaning the muscle tissue in the heart, ischemic injury is a common pathological process in patients suffering from cardiac conditions, including atherosclerotic coronary artery disease, acute myocardial infarction, and cardiac transplantation. Meaning ischemia is a common problem when dealing with issues surrounding heart disease. This study goes on to say that hydrogen gas exerted marked myocardial protection. It concluded that hydrogen gas protected cardiomyocytes from ischemia-induced injury. So essentially, hydrogen protected the cells in the heart's muscle tissue from being damaged during this injury. In this study, they concluded that the use of H2 during ischemia and reperfusion reduced infarct size and maintain cardiac function. They also determined that this administration may be useful for planned coronary interventions or for the treatment for ischemia reperfusion injuries. The reduction of the infarct size with the administration of molecular hydrogen is also mentioned in this study. An infarct is a small area of dead tissue resulting from an obstruction of blood supply. A myocardial infarction is also known as a heart attack. The mentioned study is about the protection of molecular hydrogen for the myocardium against ischemia reperfusion injury. The study concluded that molecular hydrogen is a novel, simple, safe, and effective method at reducing the effects of myocardial ischemia reperfusion injury. Number 4, hydrogen may significantly reduce cardiac hypertrophy and cardiac fibrosis. So first, let me explain what these two things are. Cardiac hypertrophy is abnormal enlargement of heart tissue from the increased size of its cells. Cardiac fibrosis is an abnormal thickening of the heart valves. This study gives a good statement about cardiac hypertrophy. It says, although cardiac hypertrophy has traditionally been considered as an adaptive response required to sustain cardiac output in response to stress, long-standing hypertrophy will eventually lead to congestive heart failure, arrhythmia, and sudden death. Yikes! This study goes on to say that heart failure is often preceded by left ventricle hypertrophy. The results of the study indicate that the administration of H2 prevented cardiac hypertrophy and improved cardiac function. This is a different study where the results suggest that molecular hydrogen not only significantly decreased cardiac hypertrophy, but it also alleviated cardiac fibrosis, among other benefits. And finally, we see in this study where the inhalation of H2 gas prevented hypertrophy and fibrosis in the left ventricle. Number 5. H2 may play an important role in improving atherosclerosis. Atherosclerosis is the buildup of fats, cholesterol, and other substances in and on the artery walls. It is the primary cause of heart disease and is the underlying cause of 50% of all deaths in westernized societies. If H2 can play a role in atherosclerosis specifically, it would therefore potentially have a major impact on heart disease. To quote this study, because human atherosclerosis is primarily a consequence of vessel wall inflammation, hydrogen administration may thus represent a useful therapeutic strategy for avoiding or treating atherosclerosis. This study suggests that H2 may significantly reduce atherosclerotic lesions and decrease oxidative stress in the aorta. It goes on to propose that the consumption of hydrogen water has the potential to prevent arteriosclerosis. The finding from this study suggests that the continual consumption of hydrogen water decreased oxidative stress levels and prevented the formation of atherosclerosis. The last two quotes come from a human study. It says the present findings highlight the potential role of H2 in the regression in hypercholesterolemia and atherosclerosis. The study goes on to state, therefore we conclude that oral administration of H2 water may prevent or delay the development and progression of hypercholesterolemia and atherosclerosis. Number 6, molecular hydrogen has the potential to decrease high blood pressure. According to this study, there is a strong, significant, and independent association of elevated blood pressure with cardiovascular disease mortality risk. Let's revisit this study where it explains that the heart function parameters, including left ventricle systolic pressure and left ventricle diastolic pressure, were significantly improved with hydrogen administration. This publication reviews data suggesting sessions with hydrogen-rich solution decreased systolic blood pressure. And this study concluded that H2 is helpful in the recovery of systolic blood pressure. Perhaps an even more intriguing quote from this article states that the results showed that after treatment with hydrogen, high blood pressure genuinely decreased for the patients, and in some instances, patients reached normal tensive status. It also concluded that hydrogen was able to stop inflammation and improve blood pressure. Number 7, H2 has demonstrated the ability to potentially normalize or benefit cholesterol levels. Cholesterol is often characterized as HDL, or healthy cholesterol, and LDL, which is bad cholesterol. As mentioned in this study, a high level of HDL cholesterol is reported to protect against cardiovascular disease, and low HDL cholesterol levels increase the risk of heart disease. In this study, it states that HDLs are known to protect against the development of atherosclerosis, and are widely documented as a negative risk factor